Proper travel history taking is essential for the diagnosis of malaria. It is important to know where the patient has traveled in order to determine which type of the parasite is causing the disease and to choose the anti-malarial drug with known sensitivity in that region. It is also important to recall that Vivax and Avali can cause disease even 1 year after the primary exposure in an endemic area. And of course, patients must be asked if they were taking anti-malarial prophylaxis while visiting the endemic country. This question, however, is insufficient. Patients should also be asked if they started the prophylaxis before departure, if they ever missed doses, or continued prophylaxis for the determined period after returning home. The classic triad of paroxysmal attack, anemia, and splenomegaly will assist in the diagnosis. The fever pattern can provide insight into the parasite type. At this point, you will want laboratory proof. Nothing is better than a good old peripheral blood smear. It's cheap, easy, and effective. Remember that thick and thin smear always go together. The thick smear is good for screening because a lower level of parasitemia can be detected. With thin smear alone, it's easy to miss the infection. However, for species differentiation, a thin smear is needed as a thick smear alone will not give you information about the type of Plasmodium. Note that the level of parasitemia and the severity of infection do not necessarily correlate. In severe malarial cases, parasites can be concentrated in different organs and not seen in peripheral blood in large amounts. For rapid diagnosis, dipstick antigen capture tests are now available. QBC is an immunochromatographic test with an immune-specific antigen-antibody binding in blood that causes color change. There are also immunofluorescent tests when immune binding emits fluorescence, and this light emission can be seen under a specific microscope. PCR is used occasionally and retrospectively. Let's learn how to prepare blood smears. On the upper right picture, you can see the circles of the thick smears and the squares of the thin smears. Whenever possible, it is better to use separate slides for thick and thin smears. For preparing thick film, put a drop of blood on the slide and then use a corner of a clean slide. Spread the drop of blood in a circle the size of a coin with a diameter of 1 to 2 centimeters, seen in the lower right picture. Do not make the smear too thick or it will fall off the slide. You should be able to read newsprint through it. The ABC pictures on the left show how to prepare a thin smear. A. Bring a clean spreader slide, held at a 45-degree angle toward the drop of blood on the specimen slide. B. Wait until the blood spreads along the entire width of the spreader slide. C. While holding the spreader slide at the same angle, push it forward rapidly and smoothly. You should wait until the thin and thick films are completely dry before staining. The thin film should be fixed with methanol, 100% or absolute, and allowed to dry completely before staining. The thick film should not be fixed. Rapid dipstick antigen tests are based on the detection of antigens derived from malaria parasites in lysed blood using immunochromatographic methods, in which color changes after specific immune antigen-antibody binding. Most frequently, these tests employ a dipstick or test strip bearing monoclonal antibodies directed against the target parasite antigens. The test can be performed in about 15 minutes. The test strips are depicted in the slide, with detection lines showing both anti-malaria antibody and, more specifically, the anti-falciparum antibody. The right picture shows an immunofluorescent test, with green light emitting from the parasites inside the red blood cells.